prioritizing healthcare. It's actually something that we can say exists. And that's why, as much as we are saying the country is on a cash crunch, the reality of salary delays for healthcare workers has been there from the devolution. It has been a consistent problem. And that's why we've seen more than 100 strikes in counties over the last 10 years. And this is, we say it's a deliberate. We think that the governors always use the healthcare workers as a chip of bargain with the treasury and with the government. And it's high time, actually, that we see that healthcare workers need to be treated differently. Just the same way we have the Police Service Commission, we have the Teacher Service Commission. Governors said clearly that they had depend on the exchequer's funds to actually pay healthcare workers. Then why should money come from the treasury to the conduit of the governor's accounts, then to the healthcare workers? Why can't we have a centralized body that then now will just pay healthcare workers directly? Because then that will change this conundrum of every month. As I told you, Kisumu paid February salaries last week. Some counties paid after 3 months. Taita Taveta has been having perennial salary delays. Mombasa had the same scenario. So these are things that are continuous.
In that situation, who is to blame here? Because the counties are saying they haven't received their allocation and those are delays coming from the national government. The same national government that some of your healthcare workers have been arguing that healthcare should even be reverted there.
I would say there's an existing inefficiency in administration between the national government and the county government. And the healthcare workers should not fall into these inefficiencies in administrations. The healthcare workers do their job faithfully at the hospitals. So the failure to pay them and expecting them to be at work faithfully is immoral in one way. It is not objective. It is against the law. It contravenes all rights in essence. So ideally, some people should be paid. And we are saying that we are giving a permanent notice that every county need to pay the health workers by 5th. Because you saw here recently when parliamentarians, for the first time since independence, I heard it on the news, had the salary delay with 4 or 5 days. There was a problem in the whole country. But we face this every month. We have normalized salary delay. It is not right. And that's why we are saying on Wednesday, the county governments need to know that healthcare workers have a right, and if health is an essential service, then prioritize them.
So what happens when the counties don't receive their allocation on time?
They should, if this discussion had come earlier, they should actually say, we are tired of managing this healthcare and we cannot manage it. And I remember Prof said this one time, that health should go back to national, not really health, the health workforce aspect of it. We can have primary healthcare remaining with the counties, because we've seen ECD successful within the counties, but the health workforce, which in essence will be budgeted for just like other independent constitutions, like independent commissions, like I said the Teacher Service Commission, the police, we will not have all those issues. Okay. But you see, in this case where the funds have come to the counties, and the counties have other projects that they will prioritize over the healthcare workers, until healthcare workers give notices that these monies get to be paid. Okay. It's not right.
Munene, is there a policy shift that we require where the HR services, at least of the healthcare workers, then reverts to the national government?
You know, Obija, we find ourselves in a very tricky situation, and I know the president also finds himself in this tricky situation. Because during his campaigns, there was this promise, and I remember I'm the one who brought this issue to Parliament, last Parliament, that we needed a Health Service Commission. But the Council of Governors and the governors really fought that idea. They said that we are crawling back on the achievement of devolution. We can't take care of the back to national government. And I think the president accepted that, because I believe the president respected devolution and said, it's okay, let's have health in the county government, but because of the issues of policy, because policies run across the country, they are not county-based, because of the issues of regulations, let's have a KLAC, a Kenya Health Human Resource Advisory Council, that will learn the issues of managing health workers, but not their pay. Let their pay be, the payroll remain at the county, but their management policies. So that we can be able to share things like specialists, we can be able to learn things like internships as a national government together. But if you try to touch the issue of health workers and county governments, you'll be accused of crawling back on the achievement of devolution. I don't really think devolution has been a bad thing, because looking from where we have come from in the health sector, it has not been no bad for governors. They have tried. If I go to county government and visit some of the hospitals that I used to see before devolution and health centers and clinics, I believe they have tried, but there is much we can do.
Okay. Governor, is forming a health service commission one of the possible solutions in your view?
It is not.
Why not?
It is not, because, you see, it's a very simple idea that a self-service commission, by its very name, will solve the problem. Nobody has told me in details, chapter and verse, how the Health Service Commission will be the solution. It's just asserted. It is assumed, but once you mention a commission, ipso facto, it becomes a good thing. Nobody has given me good reason, well reasoned, why a Health Service Commission will be better than what's going on now. Nobody. It's always asserted, but why it is going to be useful and how it's going to be used, how it's going to work, how it's going to improve the situation. We are very sensible, by the way. If you bring us that paper and we are convinced, we shall follow. We are not idiots. Just do it. Sit down, write about Health Service Commission, bring it to the Council of Governors. We shall.
All right.
Yeah, I think when you look at...
Davji, how is the Health Service Commission going?
When you look at the country, and I think this has been in the public, we have about 4,000 unemployed doctors. We have some institutions, even in Kisumu, like Ahero, which are being closed because they're understaffed. We have that in the last 5 years, from 2017 to 2022, on record, of the number of doctors that have graduated, only 10% have been employed. We have the same to clinical officers, the same to nurses, the same to all these other cadres in the country. In fact, from the Council of Governors report of 2021-2022, the whole country, they only employed 700 healthcare workers, which was amounting to about 3% of the graduates of that year. That is a clear demonstration that the devolution of healthcare is not working as expected.
So what will the Health Service Commission do?
That's what I'm coming to. Yeah. Because then now, with all this dependent on governors to look at the budget and see where they can employ, they've not been employing. So with the Health Service Commission, there'll be a budget that is set aside for annual recruitment of healthcare workers as per the need of the country. In this country, we need about 60,000 doctors to reach the WHO recommendations of 1 to 1,000. But I can tell you they're not employing. The same to the nurses, the same to all these other cadres. So with Health Service Commission, this budget will be there. We have seen teachers being employed every year. We have seen police being recruited every year because that budget is set aside and is not subjective to other activities within the counties. So this will be one thing. Number two, we look at the issues of promotions and the issues of CBA negotiations. It will be a streamlined process. There will be no need of having an industrial actions to actually have these things implemented. But what is the overall benefit it has to the nation and to the people? We have seen counties not employing. If you go to hospitals currently as it is, you will not see doctors, you will not see nurses. And why are you not seeing them? Because they have not been employed. And the governors and the CECs and the political leaders do not visit these public facilities. So they do not see the danger of not having healthcare workers in the facilities. Building the hospitals and having them beautiful cannot assure any kind that they'll have services. But when you have at annual recruitment, you will have an hospital, and then the governors with it, the facility can now demand from the Health Service Commission the doctors to be brought down. Now, every county will tell you that according to the controller of budget, they've reached the ceiling of the amount that they can spend on wages and the amount they can use to employ any healthcare worker, and they're not going to employ. Yeah. So we are not going to see any changes in public health delivery in the country.
Okay.
Yes.
But Munene, there are those who say that the Health Service